Hello, everyone. I'm Melinda from the Akasis recruitment team, and welcome to our monthly podcast session. Today, I'm thrilled to introduce you to Daniel Akko, one of our exceptional project managers based in Nigeria. Daniel joined Akasis in 2024, bringing an impressive track record and a wealth of experience managing large scale public health initiatives across Nigeria, from malaria and measles to polio. In today's episode, we'll explore what it's like to lead high impact health programs on the ground in Nigeria, hear about the challenges and breakthroughs, and learn what keeps Daniel motivated in his mission driven work. Welcome to the podcast, Daniel.
Thanks a lot, Melinda. Great to be here.
Thank you for accepting my invitation. To start, could you please introduce yourself and share what inspired you to join Akasis?
Yeah, sure. Thanks again, Melinda. I'm Daniel Akko, a project manager here in Nigeria. I've been in the public health and management consulting space for close to a decade now. I'm working on efforts to improve health outcomes across the country. I've had the chance to be part of both rewarding and tough projects aimed at improving routine immunization, reducing malaria mortality, and sometimes it's also building capacity of senior and mid-level government staff, supporting integration of campaigns like polio and measles, and more recently, really focused on driving accountability within the polio program here in Nigeria. What drew me to Akasa? That's an interesting question. Honestly, I'll say is the boldness of the mission. You're not just reacting to problems, you're shaping how decisions are made, both strategically and also operationally. I remember a few weeks after joining, I was already part of the national strategy call for integrating two life-saving vaccines, which is measles and polio, across 19 states in the country. That's interesting. That was like frontline stuff, right in the room where critical problem solving and real decisions happen. That kind of exposure is really rare. And that's what made me join Akasos in the first place, to help make brave and meaningful change happen. That's what Akasos is really all about. And honestly, it's been an exciting ride.
That says so much about how intentional and strategic this work is. It's not just about reacting, it's about driving the change. Can you walk us through what a typical day looks like for an Akazi's project manager in Nigeria? We're especially curious about travel and field visits, who you travel with, what you're observing on the ground, and any other key aspects of your daily routine.
Thanks, Belinda. That's an honest and interesting question. Um, to be honest, I don't think there's any typical day here in Akasos. One day, I'm at the Polio Emergency Operations Center in Abuja, defining strategies to improve polio campaigns, working very closely with the government and partner stakeholders to understand how to reach missed communities and missed children. Some other times I'm reviewing readiness data to ensure successful implementation of a campaign, or maybe leading a training session to build capacity of the teams we have here in Nigeria. And then the next day, I'm either in Lagos, in Kano, or in Sokoto, riding through bumpy roads, tagging along with vaccination teams to see how effective what we have on paper at the national level is translating to implementation on the field. I remember sometimes my project director will say, or sometimes makes jokes that I'm in three meetings at once. And honestly, that sometimes sounds true. The role requires you to push, to multitask and juggle a lot at the same time. But that's what makes it interesting and keeps you moving. We often travel with government teams, sometimes with the WHO, UNICEF, and other strategic polio partners. I remember in Kebbi, most recently during the last campaign, we caught a micro planning error just by having a conversation with the local immunization officer through the supervision. Fixing that really meant that thousands of more children will be reached during that campaign. It's that mix, to be honest, where we have data and that feel great that keep the work fresh and keeps you learning. And yeah, definitely keeps you on your toes and make you excited for the next day.
Wow, sounds intense, but so rewarding. I can imagine no 2 days look alike, and you never know what problems you need to solve next. What have been some of the toughest challenges you've faced, and what achievement are you most proud of despite those obstacles?
Hmm, one tough one, driving accountability, especially when the data isn't reliable or trusted. There was this campaign we were preparing for where in northern states was showing green scores on the readiness dashboard, basically said when it comes to this particular KPI, we're ready for the campaign. But when we got into the field, it just didn't match what we were seeing. So we knew we had to come or we had to do more. We started mixing with what we saw, what we heard, talking to supervisors, reviewing field reports, triangulating data, and building routines with key stakeholders to be able to better prepare for this campaign. To be honest, that then became the foundation of how we designed or redesigned the accountability framework for the polio program. We use this approach across several campaigns, and we have seen frontline teams start to really own performance. A few states, we even held late night meetings just to troubleshoot and act on what the data was showing and how we're able to bring this up to the front line for them to react to it. That moment, I thought, yes, this is working.
That's such a big win. Changing how people think about data and accountability, especially in complex systems, is no small feat. Really inspiring. Having worked in both public and private sector organizations, what do you see as the biggest difference when it comes to making an impact on the ground?
That's a great question. In the private sector, I think things move very fast. Decisions are quick, incentives are very clear. In the public health, things are a bit slower. There are more layers, more stakeholders, more politics. You have to align a lot of people before anything moves. But here's the thing: when something does move, it moves big. We once supported the government to tweak how vaccination teams were selected, trained, and even held accountable on the field. Just that small change on paper, but that then means that teams were hitting daily targets and more kits were reached. That's huge. So yeah, it may take longer, but the scale and impact is totally worth it.
And that's exactly why this work matters. The ripple effects can shape outcomes for years to come. You've just dedicated your career to working in Nigeria. What keeps you here, and why do you think more talented professionals should consider working in this context?
Yeah, Nigeria is complex, no doubt, but it's also full of possibilities. I remember during the recent campaign, we shared performance data with the local government and the state teams. And right there in the room, we made the key decision that completely changed how we're thinking about supervision for the next day and even all throughout the campaign. That kind of energy, that speed, and that openness to change is powerful. To be honest, I stay because I know the stakes are high. Every smart decision here could literally save lives, especially the vulnerable children across the country. And for anyone who really wants to make real change, that real purpose and a chance to be able to lead early, Nigeria is the right place. You grow fast and your work really makes a difference. And you can really see how that translates almost on a daily basis.
There's no doubt it's a difficult environment, but your passion for the work really shines through. What do you love most about working in a Casas, and what's your most memorable moment from your time here so far?
Interesting. What I love most, the trust. From day one when I joined Akko, I was given that real responsibility. Makes me understand that I'm not just observing, I'm helping to shape the path forward. I love how Akko invest in growth. I've had the opportunity and chance to learn across countries. I was in Pakistan earlier this year, just learning how the amazing team over there is tackling similar issues in eradicating polio. I've taken part in training both within Nigeria and abroad, and the personal and professional growth has really been incredible. But one of my favorite moments, just thinking about it again, is sitting in the strategy session at the National Emergency Center. We just rolled out our new accountability dashboard that shows performance across critical KPIs. And when we discussed this with state, I watched how the national and state teams depleted their own numbers. Some asking, why are we behind here? What's working in state X is not working here? That's when I remember during our onboarding session on training on delivery 101, where it's interesting to leverage routines to get decision makers to react to the data, to make changes. Then I realized we're not just handing or presenting PowerPoints, we're changing really how the teams think.
That's a real goosebumps moment. Seeing tools you've helped build actually being used by government teams to drive real time decisions. That's true impact. Thanks again, Daniel, for such a thoughtful and inspiring conversation. It's always powerful to hear directly from our teams on the ground. Your insights really bring the work to life. And to everyone listening, thank you for joining us. We hope this episode gave you a deeper look into what it means to work at Takasis, especially in complex but high impact settings like Nigeria. If you enjoyed this episode, be sure to follow the Akasis podcast on Spotify and connect with us on LinkedIn, Facebook, and Instagram to stay updated. We'll be back soon with more stories from across our global teams. Until then, be well, stay inspired, and remember, real impact takes patience, partnership, and probably one more calibration call than you expected. Catch you next time.